Hey everyone, we've got another specimen today. Today we have number 643 in our collection. The heart would have sat in the chest like this. Superior head would have been here. Inferior, the legs would have been down here. Left here, right here, anterior surface coming out towards the screen. Posterior surface towards the turntable. So we'll do what we usually do and try to find what which externally looks like the morphologic right atrial appendage. And it appears that this is it. Triangular, broad-based pyramidal. So we'll go ahead and open that up. And when we open that up, we do see pectinate muscles that spill outside the confines of the atrial appendage, consistent with a morphologic right atrium. And then when we look at the rest of the atrium here, we do see the oval fossa. And we do see that there appears to be a little bit of a defect in this oval fossa here, okay? And you can see that the probe passes nicely into the left-sided atrium. But we'll return our attention back to the right atrium. And then we find the mouth of the coronary sinus here. And so when we find the mouth of the coronary sinus, we also see the tendon of Totaro, which is here. And then we find the tricuspid valve here. And so we can create our triangle of Koch, which is going to be bounded by the mouth of the coronary sinus, the tendon of Totaro, and the tricuspid valve. And at the apex of this triangle, so about here, would be where we expect the atrioventricular node to sit. So once again, the triangle formed by the mouth of the coronary sinus, the tendon of Totaro, and then the tricuspid valve at its apex is where we expect to find the atrioventricular node. Now, when we look to the right atrioventricular junction, we find that there is a tricuspid valve here, which doesn't appear normal, appears fairly small. When we try to put this together, you can see that the orifice of this tricuspid valve appears quite small as well. So a hypoplastic tricuspid valve, which leads into a ventricle that also appears quite small. It's really hard to make out any true trabeculations here, and it's really hard to delineate a septomarginal trabeculation. So we'll have to trust that this is a morphologic right ventricle. And we see that there's no true egress from this ventricle. Now, when we look externally, we do find a pulmonary trunk here. And when we look down at the valve, we do in fact see a pulmonary valve here, but obviously no opening from the right ventricle into that right ventricular outflow tract. So pulmonary atresia. And then when we look at this ventricular septum here, intact, so we are dealing with pulmonary atresia with intact ventricular septum. And unfortunately, the branch pulmonary arteries have been transected, but have been recorded to be of good size. So now if we turn this heart onto its back and take a look at the posterior aspect of this heart, we find another atrium. This time this is a smooth-walled atrium with pectinate muscles all confined within the appendage itself. So that's consistent with a morphologic left atrium. We do see the oval fossa from here as well. And remember, we've seen that there is a small intraatrial communication in the oval fossa. We find that the left atrioventricular junction is guarded by a 2-leaflet atrioventricular valve that does not have any septal connections. So here's the ventricular septum. Here's one of the leaflets of that valve. So a 2-leaflet left-sided atrioventricular valve without any septal connections, so consistent with a morphologic mitral valve. We would expect that this ventricle would then be a morphologic left ventricle, and it in fact does appear to be with fine crisscross trabeculations, which helps strengthen the fact that the other ventricle we saw earlier must in fact be a morphologic right ventricle. Once again, from this side as well, we see that the ventricular septum is in fact intact. We do find another semilunar valve here, this time with 3 leaflets and 3 sinuses, consistent with a morphologic aortic valve. And if you look within these sinuses, you will find the coronary arteries arising from them as well. And here's one of the coronary orifices here. So here is the ascending aorta, transverse arch, and the head and neck vessels, and then the descending aorta, which has been cut. So a specimen with pulmonary atresia, intact ventricular septum, a small right ventricle, and a small tricuspid valve.